From the FOX6 studios, this is Ask Contact 6. This is a segment where we bring in experts to answer your questions. The topic we've chosen for today is Medicare open enrollment. About 66 million beneficiaries have 1 month left to review their Medicare coverage and make changes for 2026. We received a wide range of submissions, and to answer those questions today, I have Nick Lutz with us from the Wisconsin Board on Aging and Long-Term Care. Nick, thanks for being with us.
Yeah, thank you.
Can you start by telling us a bit about the Medigap helpline, which you supervise?
Yeah, so it's a program at the Wisconsin Board on Aging and Long-Term Care, and what we do is we offer free Medicare insurance counseling to beneficiaries across the entire state. Our program is primarily phone-based. However, we're a part of a statewide program that is called the State Health Insurance Assistance Program, or SHIP, and they provide insurance counseling services to beneficiaries across the state. We have local people at local ADRCs and local community organizations that also do that SHIP work, so we're a part of that larger network, but we operate that primary statewide phone line.
Well, thank you for lending your expertise here today. I'm sure all the people who submitted questions will appreciate it. We'll get to those questions in a little bit. First, we did have to paraphrase or edit a couple of questions for clarity. Also, Nick will do his best to answer your questions today based on the information we have. But for more advice on your specific case, you may want to call the Medigap hotline at 1-800-242-1060. Let's get started. Reading our questions again today is our Contact 6 associate producer, Annette.
Hey. So our first question comes from Linda in Germantown. She says, I'm new to Medicare. How do I find a Medicare supplement broker who could guide me? So her question, how do I find a Medicare supplement broker?
Question for you. Do a lot of people use brokers?
Yeah, if you're looking to purchase a Medicare supplement policy, it's pretty much the only way to purchase a policy. There's a good variety of ways to find those Medicare supplement brokers. The first way is just an online search looking for Medicare supplement brokers in your area. I'll note that if you call our program, we can't make referrals to specific agents and specific brokers because of some of our grant funding and because we want to give that unbiased information. So if we were referring all of our clients to one agent or one broker, that would present some challenges to that goal. And I'll say those online directories do have some really great search tools of just all the brokers available in your area. I'll also note that our webpage, which is longtermcare.wi.gov, does have a list of all of the Medicare supplement insurers that are selling policies. And if you call those numbers, they can connect you with brokers that are authorized to sell their policies. And the big thing here is just making sure that you receive a quote from multiple different insurers when you're looking at a Medicare supplement policy. If you went to purchase a car, you wouldn't go to one dealership and buy the car right away. You'd compare prices with a few different companies, a few different insurers.
Is there any way of comparing whether one broker is better than another? Is it that they're online reviews? How do people do that?
Yeah, that's a question we get a lot, and it's one that I think is really challenging to answer because there's not a lot of, like a star rating system for brokers. Again, what I would say is when you're purchasing that Medicare supplement policy, it's the same insurance regardless of what insurer you purchase it through. So at the end of the day, you're going to end up with the same benefits, the same coverage. I think it's more important to prioritize, just some of those other consumer things you're looking for, good customer service. I'll note that we also have another publication on our website that has a list of questions you should ask a broker. It's actually a CMS, Center for Medicare and Medicaid Services publication that outlines a list of questions you can ask an insurance broker when you're looking to purchase that policy. And one of those is just, has the premium for this policy increased in the last 3 years? If so, how much? That can give you a picture of potential future rate increases. So the advice around purchasing a Medicare supplement policy, I would say, is shop around, get a few different quotes, make sure you have a good idea of what the different price points are, because at the end of the day, if you're looking at the same policy, it's going to be the same insurance from one company to another, which I think is very different when we look at any other consumer decision we're making.
Okay, good to know. Linda, thank you so much for that question. What is our next question, Annette?
Our next one comes from Yvonne in Menominee Falls. She would like to know, are there any plans that cover co-payments, transportation to medical visits, and food benefits? So the question, do plans cover co-payments, transportation, and food benefits?
What are your thoughts on this question?
Yeah, so I think in the question she's talking about Medicare Advantage plans. And in short, the answer is yes. Lots of Medicare Advantage plans are going to have benefits that are outside of what's typically covered by original Medicare. Those are those Part A hospital services, those Part B outpatient services. And I'll say those extra benefits can include a variety of non-Medicare covered services. You see it with vision and dental and, like she mentioned in the question, transportation payments and food benefits. I'll say every plan is different. So, if you're looking at two different Advantage plans, their extra benefits can look substantially different, even if, they're offered by the same company. So there can be some good differentiation between those offerings. And then I'll also say when you're looking at a Medicare Advantage plan, at the end of the day, you're looking for a health plan and a drug plan. So it's important to, prioritize and make sure that that plan is meeting your health and prescription drug needs before maybe looking at those extra benefits. I know they can be very tempting. I know you can see lots of commercials on TV about the extra benefits offered by plans and things like that. But at the end of the day, you're enrolling in a health plan. So it's important to make sure those health concerns are met before you look at those extra benefits.
All right, that was good advice. That's all I think we need to say for Yvonne's question. What do we have next?
Next is Scott's question, and he lives in Slinger. He would like to know if my employer offers medical insurance, can I switch to Part B anyway for less cost? I'm 68, still working, and have Part A. So his question, can I get Part B if my employer offers insurance?
These questions make me realize how little I know about Medicare since I haven't gotten to that stage of life yet. Is this a pretty common question?
Yeah, I would say this is a really common question. I would say outside of the folks that are newly starting Medicare, it's one of the more common questions we'll get at our program, which is, I have X, Y, and Z current insurance. Should I join Medicare? Do I have to join Medicare? And I would say with the employer consideration, assuming, this caller's eligible for Medicare, you do have an ongoing special enrollment to join Medicare when you lose that employer coverage, that active employer coverage. So that could occur, due to a retirement, due to, a termination, unfortunately, if that occurs, due to just choosing to leave the employer health plan. And if you make that choice, it's just important to understand that when you're typically in an employer plan, you're going to have a pretty fixed health plan. You're going to have, one premium. You're going to have a maximum out of pocket. You're going to have a deductible. When you join Medicare, there could be a couple different premiums. So you could have that Medicare Part B premium, which this year is $185. And then you could also have a Medicare supplement premium and a Medicare Part D plan premium. So you could end up looking at a higher monthly cost than maybe that employer plan. And with that, if you decide to go with some lower premium alternatives, when it comes to your Medicare coverage, you might be looking at more out-of-pocket costs than that employer plan. So I think it's important to really take a look at the full picture. And I would say if you were just roughly trying to run the numbers, I would take, assuming you're relatively healthy, a couple $100s a month. That's what you're going to be paying in premiums on Medicare. So if your health plan is less than that, you might be better off in that space.
All right, that's great to know. What is our next question?
Our next question comes from Pam in Muskego. She says, I'm turning 70 in December and still working. My husband is 68 and a farmer. We have insurance through my employer. I plan on retiring next year in July. When should we apply for Medicare? Thank you. So her question, when should I apply for Medicare upon retirement?
Something else that I never considered. Do you have to sign up during open enrollment in anticipation? Or do you have to wait until you're no longer employed somewhere? Or do you prepare for that transition? When would Pam, if they're retiring in July?
I think your viewers might be sensing a theme at this point, but
Yeah.
the answer to that is it depends.
Okay.
Depends on your situation. But I would say with this caller's situation, they have that ongoing special enrollment period to enroll in Medicare when they decide to leave that employer coverage. So I would look 1 to 2 months before you're thinking about ending that employment, apply for Medicare. And that's going to be done through Social Security. You can do it online. I would recommend to get that application processed quickly, doing it online if you're able to. And then once you start Medicare Part B, that's when you have all those choices around, do I want to purchase a Medicare supplement policy? Do I want to get into a Medicare Advantage plan? Do I need a Part D plan? All of those considerations will come into play at that point. I'll note if this situation was happening to somebody who was under 65, it's important to look at when you're turning 65, you have your initial enrollment period into Medicare, and that occurs 3 months before the month of your birth date, the month of your 65th birth date, and 3 months after. So it's going to depend on your age. If you're under 65 and looking to enroll, you're going to want to use that initial enrollment period. If you're still actively working and you have a large employer, which most people who are working do have a large employer as classified by Medicare, so that's over like 50 employees or 20
Oh, got
employees,
it.
depending.
Okay.
Yep.
Yeah, it makes you just think about how much there is to consider. I have to imagine it's pretty overwhelming for people when they first sit down. What's Part A? What's Part B? What's the difference between Medicare and Medicare Advantage? Is there any way to just educate yourself on the basics? Is it go to a website or speak to an expert?
I think the first step is just, having that desire to learn more. I think that's really important. And then you're going to get the Medicare and You book when you're about to turn 65. That's a really great resource, has tons of information. I would say it probably has more information than most people need to make their informed insurance choice, but there's lots of resources out there online. One of the things I'm gonna highlight is Medicare.gov, which is Medicare's webpage. You can go there and you can compare all of the Medicare Advantage plans, all of the Medicare Part D plans that are out there, and you can even create an account that'll have your prescription drugs in there. You can now connect your providers. They have a new provider tool for this year. So if you're looking at Medicare Advantage plans, you can put in your providers and see which Advantage plans are in network for those providers. But outside of that, I would say, just reaching out to those local resources, talking to your friends, family, other people on Medicare. Those can all be great resources to get a little bit more information. I'll say if you're looking for some of the unbiased assistance we can provide, you're welcome to give us a call. Also, those local SHIP affiliates do have in-person services. A lot of counties do new to Medicare presentations where they'll give you an overview of Medicare and what some of your options are. And those can be found at dhs.wi.gov/Medicare-help.
Okay.
And that's going to have all of the SHIP services.
Yeah, I think I've seen advertisements for those at local libraries and senior centers this time of year. That makes sense. Annette, who is our next question from?
It's from Dorianne in Milwaukee, and here's her question. Is one Medicare Advantage plan a lot better than another?
So, very direct question there. What are your thoughts?
Yeah, obviously, as I mentioned earlier, I can't necessarily promote one plan over another, so I'll answer this by saying they're different. There's going to be a lot of things that can vary from one Advantage plan to another. The first thing that I think is most important to consider is the provider networks. If you want to see specific providers, you're going to have to make sure that the Advantage plans you're looking at do have those providers in network. And I'll say all the Advantage plans are going to have different networks. There's counties I know Dane County specifically has around 40 Advantage plans, so there's a lot of choice in this space. And I think the first place to start is reaching out to your provider and seeing which plans they accept. And then you can kind of narrow that down further when you're looking at what are the co-pays and co-insurance you're looking for. So when I go to the doctor, how much do I want to pay? And along the lines of that is every Medicare Advantage plan is going to have what's called a maximum out-of-pocket. And that's exactly what it sounds like. It's the maximum you could pay in a year for your health care. So it's important to know that maximum out-of-pocket if you're somebody who is going to be experiencing a lot of inpatient services, or you think you might be at high risk for hospitalization, that can limit your risk. So you could have a lower maximum out-of-pocket. That way you're exposed to less medical expenses. The last thing to look at is prescription drug coverage. So some Medicare Advantage plans are going to have prescription drug coverage included. Some are not. The important thing to consider is if the Advantage plan doesn't have prescription drug coverage in it, you can't get a standalone Part D plan. So it's one of those things where it's one or the other. So identifying, do I need prescription coverage, and understanding that if you wait to enroll in Medicare Part D, you can experience a penalty. So there's some other options out there for prescription drug coverage if you're not looking for a Medicare Advantage plan with Part D coverage. One of those is Wisconsin Senior Care, which is our state pharmaceutical assistance program for people who are over age 65. So if you're over 65, you can sign up for Senior Care, and that'll give you that credible coverage you need to avoid the Part D penalty later on.
So I know you said people should look up whether their specific provider is in one Medicare Advantage plan. Should they also look up whether specific prescriptions, or does it not get that specific?
It does get that specific. Every plan is going to have what's called a unique formulary. So that's a list of covered prescription drugs. That Medicare.gov tool that I mentioned earlier is a really great resource to put in all of your prescriptions, and then you can see right there how different plans cover those prescriptions. And you can see all of the the medical expenses as well, the co-pays, the co-insurance, the
Treatments you
maximum
would
out-of-pocket.
need,
Yep.
those would all be detailed as well.
Very detailed, yes.
Oh, good. All right. And Annette, is our next question from Ellen?
It is. And Ellen's from Trevor. She says, I have type 2 diabetes and I'm on Ozempic as well as other insulins. I'm on assisted cost with the manufacturer and I've been getting Ozempic, excuse me, at no cost. They sent me notice that 2026 prescription plans are changing, so they are no longer covering Ozempic in this free plan. Specifically, Part D is no longer covering it. I have a Humana Advantage plan, and while it covers many medications, I don't see that it's Part D. Do I need to change to get Part D coverage? So Ellen's question, do I need to switch to Part D to get Ozempic?
So here's a question that does get that specific. What would you tell Ellen?
Yeah, so I would start. It sounds like with that prescription, that Ozempic, she has what's called a pharmaceutical assistance program, which that's kind of outside of the Medicare insurance space. It's those programs that are offered by manufacturers, like the people who make Ozempic, to make that drug more accessible to people at a lower cost. I would say for her situation, I would guess her Humana plan has Part D included in it. Most Advantage plans include Part D. It's a pretty significant majority. And if she has Medicare Part D, it's important to look at what her cost would be in that Part D plan without that prescription assistance program for Ozempic. And Ozempic is one of those weight loss drugs that are considered by CMS to be weight loss drugs. And those prescriptions, you need a specific diagnoses for them to be covered by your Part D plan. So Medicare has some additional restrictions for those weight loss drugs to be covered. You need a qualifying condition. An example that we see a lot of is type 2 diabetes. So if you have type 2 diabetes and your doctor decides that prescription is going to be effective in treating that condition, your Medicare Part D plan will cover it as long as it's on the formulary. So they're all going to have unique formularies as well. And I'll note if a prescription isn't on your formulary, so if you notice your plan is changing and you don't want to switch plans or it's covering most of your drugs, maybe except for one or two, you can request what's called a coverage exception, which is through your plan, you request that they cover this drug. And all you have to do for that coverage exception is to submit information that your doctor says that prescription is needed for you to treat that condition, and you can't take any other alternatives that are on the plan formulary.
All right. Lots of good information there. Who do we have next, Annette?
This one's from Chris in Shorewood. Chris would like to know, when will we be alerted to any change in Medicare premiums, or do we know already? So the question, will we be alerted to Medicare premium changes?
I'm very interested in your thoughts on this one. Have people been alerted already to changes that may be coming?
Yeah, I mean, there's been some reporting at this point. We haven't gotten the official release from CMS yet of what the Part B premium is going to be in 2026. I will say a lot of the reporting is around $206 per month. Beneficiaries find out every December. You'll receive a Social Security benefit statement. So you get those every month. The one in December tells you what the premium is for the next year. And CMS typically comes out with that new premium rate in November. Last year it was November 8th. It's November 6th today when we're taping. So I would imagine we're going to see that premium officially released in the next couple days.
Is that a higher premium than in the past?
Yeah, they're anticipating another higher premium, another premium increase. And, that is determined by the Medicare Trust Fund. They have a board that determines that. And I'll say I haven't seen it decrease, so it continues to kind of increase at a pretty steady rate.
So that's something people should just anticipate will happen.
Yeah, I would anticipate premium increases year over year.
All right. What do we have next, Annette?
Yep. This next one comes from Sandy in Milwaukee. Sandy would like to know, if I leave a Medicare Advantage plan for another, will my original plan take me back at the next open enrollment period? I hesitate to change because if I don't like my new choice, I want the option of going back to my previous Medicare Advantage plan next year. So the question, will my original Medicare Advantage plan take me back if I switch?
That's an interesting question. Is a switch something that can be changed year to year, or it's something you can navigate year to year?
Yeah, I'll say that the plans are usually willing to take folks back, as long as you're making an enrollment during one of those Medicare enrollment periods. So right now we have the annual enrollment period going on. All of those enrollments start January 1st. As long as you're making an election into a plan that's offered, you can get into that plan. I will also highlight that if she tries this new plan and decides, hey, maybe I don't like the coverage quite as much as my previous plan, there is a Medicare Advantage open enrollment period, which runs from January 1st to March 31st. And during that time, if you're in a Medicare Advantage plan, you can either change Advantage plans or enroll in Original Medicare if you choose. So there's another enrollment period if you decide during AEP, hey, I made a choice that I don't like. I don't like the Advantage plan I elected. You can return to your other plan or choose a new Advantage plan in the start of the year. So,
Okay. I didn't realize people had that option.
yeah, it's like a second chance. It's a really great opportunity if you make a decision that you're not, not super pleased with. Maybe you want to change that coverage.
All right. Annette, what is our next question?
Yep, so we got a couple questions about switching from Medicare Advantage to Medicare. The first one comes from Camille in West Allis. She writes, how easy would it be to switch from Medicare Advantage back to regular Medicare? If someone has multiple medical problems, are Advantage plans okay? I've gotten advice to go get Medicare Advantage as I have so many health problems. And then Julie in Waukesha, she would like to know, is it hard to switch from to switch from an Advantage plan to straight Medicare?
So there's sorry, Annette.
So in summary, is it hard to switch from Medicare Advantage to Medicare?
Yeah, it seems like there's a couple questions wrapped up in there, but let's start with that switch from Medicare Advantage to Medicare. Is that a challenge for people?
I would say that's probably the easiest part of this question is anytime you're in one of those enrollment periods that allows you to return to Original Medicare. So the annual enrollment period would be one, and there's a couple different ways to do that. You can do it by, choosing to leave your Advantage plan. You can also do it by enrolling in Medicare Part D. Because of the fact that you can't have an Advantage plan and a Part D plan at the same time, enrolling in a Part D plan will automatically push you out of that Advantage plan. And then I'll also say during the Medicare Advantage open enrollment period, you can return to Original Medicare. But there can be some concerns when you go to Original Medicare about potentially being able to obtain that Medicare supplement policy.
Okay. And then the other part, Camille had asked about having multiple medical problems and if she should go to Medicare Advantage for that reason. What are your thoughts on that?
I think it's going to depend again on your risk tolerance. Like any other insurance product, Medicare Advantage and Medicare supplement policies are going to offer different levels of coverage. Even included in Advantage plans, you can see varying copay structures, varying out-of-pocket costs. I will say some of the pros of Medicare Advantage are the lower premiums typically. So you're going to see lower premium rates, and then typically you're going to pay a little bit more in out-of-pocket expenses. So when you go and use the plan, you're going to have those copays and those co-insurances versus if you join a Medicare supplement policy with Original Medicare, you're going to have more flexibility because you can go to any provider that accepts Medicare, which is over 90% of providers in the entire country. And then you're going to have lower out-of-pocket costs. So you're going to have less copays, less co-insurance. You're just going to have a couple small deductibles potentially to pay. But with that insurance, you're going to see a higher monthly premium. So it's, do you want to have a higher monthly premium in exchange for, lower costs when you're using the plan, lower costs when you're seeking care versus having lower premiums in exchange for a little bit higher costs when you're going to seek that care.
Okay. Annette, we have a question from Annette, don't we?
Yes, she's from Milwaukee. She says, I will turn 65 years old in August 2026. My question is, what do I need to know or do prior to my birthday for the Medicare enrollment process? So her question, what should I know about Medicare when I turn 65?
I like this question just because I think there's a lot of general information that we could cover here. What should Annette know as she approaches 65?
Yeah, I think there's actually a lot to unpack with that question.
Yeah.
And I think it's going to depend on the person. A lot of people, have, as soon as they're starting Medicare, they have a good idea of what they want. They want either the low monthly premium amount or they want that, lower expenses when they go to seek care. I would start by just understanding what's covered by Medicare. So when I get that red, white, and blue card, what do I have? And what you have is you have hospital insurance and medical insurance through Medicare, and that medical insurance is only going to pay for 80% of those expenses. I know anybody who's been in any healthcare facility understands that 80% coverage probably isn't enough for most people. So that's when people look at other options. So you're going to have essentially two paths. The one path is Medicare Advantage. And if you decide to go down that way, you're going to end up with, some more specific provider networks, typically lower monthly premiums. And then you're going to have that maximum out of pocket, which protects you. So instead of with Original Medicare having to pay 20% of every medical bill with no cap, now you're going to have a cap and a copay structure to limit those costs. And the other option on the other side of the road is Medicare supplement policies, which are going to have a little bit of a higher premium, but you're going to have lower out-of-pocket expenses and a wider network of providers because you can go to anybody who accepts Medicare. I'll also say there is a convenience factor to Medicare supplement policies in the fact that you don't have to review them every year versus your Medicare Advantage plan is going to change every single year. So you're going to have to review that coverage and see if it's still what you're looking for.
Okay. Did I interrupt a thought?
No, I was just trying to address more of the question of where would you find that information. I guess where you would find that information is you could go to our webpage. We have some good introductory information. Again, I think that Medicare and U-Book is a really fantastic resource that people sometimes underutilize. So I think starting there is a good point. And then we mentioned those presentations in your local community. That can be a really good resource to get that base level of understanding.
And Annette had mentioned she turns 65 in August. So should she start looking into plans around like June or so?
Yeah, I would say she could start now, at least with the higher level thoughts of what kind of coverage am I looking for. And then as you get closer, I would say 2 to 3 months before you're starting Medicare is when you should really nail down what coverage you're looking for and get some of those cost comparisons between plans. So you should be able to get quotes from Medicare supplement insurers. You should be able to get information about your Medicare Advantage plans at that point. I will say if you're turning 65 or starting Medicare towards the end of the year, that can present a little bit more challenges because you're going to have an annual maximum out of pocket that's going to start in the middle of the year. So you could end up paying a little bit more for services because of that. So something to consider as well.
That is good to consider. Anything else we should tell Annette before we move on?
The first thing I would tell her is that when you make that initial election, that's a really good opportunity to try Medicare supplement policies if that's something you're interested in, because like I mentioned in one of the previous questions, you can't necessarily get that type of insurance at any time. You have to either be in that open enrollment, which is when you first start Part B, or qualify for a guarantee issue period to get those supplement policies at the preferred rate and not have to go through health underwriting. And Medicare has a really great thing. It's called trial periods. So if you enroll in a Medicare supplement policy and then decide, hey, I want to try a Medicare Advantage plan, you have 12 months to try a Medicare Advantage plan. And if you decide you don't like it, you can go back to your supplement policy. So for a lot of people, I think it can make sense to start in the supplement world, try the Medicare Advantage plan, and then decide what they're looking for, especially if you're having a hard time deciding between the two.
All right. Thanks for that advice. And what is our next question?
Our next one comes from Lynn in Hartford. She writes, I recently moved to Wisconsin and needed to change my Medicare Part C. During that process, I was asked if I had a Medicare supplement plan. When I said no and asked what that was and if I was eligible, the representative from United Healthcare could not answer that. So my question to you is, what exactly is a Medicare supplement plan / Medigap, and who is eligible to apply / buy / get a Medicare supplement plan? Thank you for your time and consideration. So Lynn's question, what is a Medicare supplement plan and who is eligible?
You've touched on this a little bit, but could you go into a bit more detail about the supplement plan?
Yeah, absolutely. I think the easiest way to think about it is it's in the name. It's designed to supplement original Medicare. So I mentioned when you have original Medicare, you can incur up to that 20% of all medical bills when you're receiving Part B services. So that Medicare supplement policy is designed to supplement those costs. Unlike Medicare Advantage, there's not like a yearly enrollment period in Wisconsin to get Medicare supplement policies. And insurers aren't required to sell you one unless you qualify for either an open enrollment period, which is when you first start Part B, or what's called a guarantee issue period. And that period occurs, if you lose employer coverage, if you lose Medicaid, that can trigger a guarantee issue period. If you move outside of a plan's area, or if your plan is terminated. We've seen lots of Medicare Advantage plans this year end in Wisconsin. And if your plan is terminated, you do have that opportunity to purchase a supplement if you choose. And circling back to what is a Medicare supplement policy, it's a type of guaranteed renewable insurance. Think about like whole life insurance, where as long as you pay the premium, you keep the policy. And it's offered by private insurance companies, again, to supplement those original Medicare costs. And again, just want to note that there is limited time frames to purchase those policies. So it's a type of insurance that's going to have a lower risk when you go to see your health provider, but you're going to pay a little bit more in premiums in exchange for that. So understanding that it's going to have a cost, the estimate I typically give people is like between $100 and $300. I know that's a huge range, but depending on your age, depending on your location and a variety of other factors, those premiums are going to be kind of in that range on top of the Part B premium.
Lynn had also asked who is eligible to get a Medicare supplement plan. Is it anyone over 65?
Anyone with Medicare is eligible. I will say, though, I did mention the health underwriting. So if you're outside of one of those two periods, so either a guarantee issue period or your open enrollment, insurers can choose to not sell you a policy because of those pre-existing conditions. And I know that's not something we see a lot of days in the insurance marketplace. Most types of insurance now can't ask about pre-existing conditions, but Medicare supplement policies are sort of that one exception. But there is those periods where you can get those policies without that health underwriting, without those questions. And the easiest time to do that is when you're starting Medicare Part B.
Okay, gosh, I will have so many questions when this time comes. What is our next question?
Our next question is from Mark in Milwaukee. He says, in 2016, I turned down my Part B Medicare because I have VA coverage. Now I'd like to get my Part B Medicare back. However, they say there's a penalty for late enrollment in Part B. Is there any way I can avoid or lessen the penalty? So Mark's question, will I be penalized for switching back to Part B?
Can that happen? Can you be penalized?
Yeah, unfortunately you can. I will say, I mentioned the Part D as in, prescription drugs penalty earlier. That works a little bit differently than the Part B penalty. The Part B penalty works for every 12 months you go without credible coverage. And I think the easiest example of credible coverage to understand is active employer healthcare. So if you're actively employed, actively working, and have insurance through that employer, that's credible insurance. So you can delay Part B without a penalty. VA coverage, unfortunately, is not a credible insurance. So you're going to have a Part B penalty that's equivalent to 10% of the Part B premium for every 12 months you went without Part B when you were eligible. So if this individual was 65 and they waited till they were 66 to get Part B and didn't have that credible coverage, their Part B premium in 2025 would look like $203 versus the $185 because of that 10% penalty. And that penalty is every single month. So that's why if you have VA coverage, if you don't have credible coverage, it can be really important to enroll in Part B when you're first eligible.
Okay, then do that mathematical equation for yourself to decide whether it's worth it or not.
Yes.
All right, thank you for that question, Mark. Our next question is from Charlene, I believe.
Yes, in Wauwatosa. She writes, I'm on my husband's medical plan from work. Next year, he's retiring. I don't plan to get Medicare Advantage. What is the best plan? I'm 66 years old, in good shape, and have medical issues such as heart problems, high blood pressure, and I'm a breast cancer survivor. She says cost is not a problem. So Charlene's question, how do I find the right Medicare plan for my health problems?
All right, so she's got a list of things that are important to her. I suppose that's a good first step. What does she do next?
Yeah, it sounds like she has a really good understanding of what she's looking for in a health insurance product. And from her submission and from those comments, it sounds like she's looking for a type of insurance that really she has a low risk when she's going to see a provider. So when she's going to see a doctor or going to the hospital, she doesn't want to have that surprise large bill that she has to pay the insurer or the hospital. So this is somebody who maybe a Medicare supplement policy would look like a really suitable piece of insurance for her or insurance coverage for her. I'll say it's going to limit those out-of-pocket expenses. It sounds like with some of those pre-existing conditions, you might be seeing a lot of specialists. So having that flexibility of network to be able to go to any provider that accepts Medicare, a Medicare supplement policy sounds like something that aligns with what she's looking for. And I would just recommend, again, getting those different quotes for Medicare supplement insurers. And if cost is not a problem as far as premiums, it can be a really good insurance product when it comes to having that flexibility to go to any provider and having really low out-of-pocket costs.
All right. We're getting closer to the end of our questions. What do we have next?
We have a question from Annette in Milwaukee. She says, my husband and I are Medicare eligible age. However, he works full time and we are not eligible for Medicare now. The company is closing probably by the end of the year. Can we apply during this open enrollment or do we have to wait until the company officially closes? So the question, when should we apply for Medicare after our company closes?
A lot of questions about timing here. I think it's a very basic question, but clearly people are curious about when you're supposed to go through this process. So if their business is closing, probably the end of the year, when should they start applying?
I would say 1 to 2 months before you know you're going to lose those active employer benefits. So when you see some of these large scale closures and things like this, sometimes you see the active employer health benefits extended maybe a little bit beyond that closure, or you're going to see a program called COBRA offered, which is essentially coverage to continue that employer coverage. And the thing to understand is if you're eligible for Medicare, and you're going to be going on COBRA, you need to enroll in Medicare Part B because I mentioned that active health benefits are credible coverage. They also pay primary to Medicare. COBRA benefits actually pay secondary to Medicare. So if you're going to be starting COBRA and you're Medicare eligible, it's really critical to enroll in both Medicare Part A and Part B because Medicare is going to pay first and then your COBRA is going to pay second. So if you don't have that Medicare coverage, you could be on the hook for 80% of the bill versus, with both the coverages, far less than that. And I'd say timing wise, you're going to want to look at 1 to 2 months before you know you're losing the coverage to start applying for Medicare.
And you do that online when you're applying for it?
You can do it a variety of ways through the Social Security Administration. I would recommend to make sure that that is processed quickly applying online. I believe they have an online form when your employer coverage is ending to apply. If you have questions, you can contact the Social Security Administration around applying for Medicare. But I will say losing that active employer coverage does give you a special enrollment period to enroll in Medicare. So you can get everything started right when that coverage is ending, so the first of the following month.
And how long should people anticipate it taking, that applying and the approval process?
Yeah, there's a lot of variance to that question. A lot of it actually depends on the time of year when you're applying. Social Security, like anything else, they're going to see times of year where they're busier and less busy with those applications. And that's where I recommend the online application whenever possible. Those seem to be processed a little bit more quickly. So if you're somebody who's concerned about the timing, that can be something that's really important. I'll also say that, if you apply and you have a start date, there's a chance it could get approved and, it could all happen very quickly. You could get approved, the 30th of the month and then it starts the first of the following month. So
it can happen that quickly.
yeah, it can happen quickly. I will say with the application process, I say to leave 1 to 2 months in case it doesn't happen quickly.
So you should be registering, signing up 1 to 2 months in anticipation.
Yep.
And if there's a little overlap with your other insurance, no big deal.
No big deal. And you can have, when you go to apply 1 to 2 months in advance, you can set that start date for the first of that month after the coverage is ending. So there's a spot on the form to put that right in there.
All right. What do we have next?
Yep, this one is from Jill in West Bend, and I believe she's asking this question in order to help a friend or a family member. So she would like to know, what is a good, affordable health insurance supplemental plan for people on fixed incomes and on Social Security and Medicare? Also, what is a good, affordable in-care facility? She says this person also has minimal prescriptions. So the question, how do I find a plan for someone on Social Security and Medicare?
I'm sure Jill's, loved one isn't alone in being concerned about being on a fixed income. So what advice would you have for people who are concerned about the cost?
Yeah, again, that's going to be one of those things where you're going to look at your risk tolerance. So if you're on that fixed income, a lower premium product might seem more appealing, especially if you know, hey, I might have some medical expenses, but I don't know if I'm going to have so many where maybe I want a Medicare supplement policy that's going to cost me a couple $100s a month. You might want to look at a lower premium Advantage plan, but then also considering that even those Advantage plans that have zero premium are going to have varying copay structures and varying maximum out-of-pockets. So kind of identifying what coverage there is most suitable. And again, I think the easiest tool to compare that is that Medicare.gov website. It's going to have all of the plans available based on that person's zip code and give them the ability to choose between the different coverage options that they have. And I'll also say with the fixed income portion of this, some of those extra benefits that I mentioned earlier that plans offer, some plans offer premium buybacks, so they'll reimburse you for part of your Part B premium. It's another way. Some of those plans will offer over-the-counter cards. So if you're, taking a lot of over-the-counter prescriptions, that can be a big help as well.
I think a lot of people just want to go in and have someone say, "Tell me what I should have."
Yes.
Are there people that can just tell you what you should be buying?
Yeah, I think in our situation in the SHIP program, we're in a little bit of a challenging situation there. We get lots of calls that are, "What should I choose?" And
Yeah.
the answer to that is always, well, it depends on what you're looking for. We don't want to push people in a certain direction. We want to remain unbiased and give them the information they need to make that decision. But I would say if you have a trusted friend, a trusted relative, If you have a trusted insurance agent, that's certainly somebody you can talk to. But at the end of the day, when it comes to if you decide to go into the Medicare Advantage world, you're going to have choices to change that coverage. So if she makes that election today to start January 1st and comes January 1st, hey, I don't really like this Advantage plan I enrolled in, you have that Medicare Advantage open enrollment period to fix that enrollment. So there's lots of second chances in the Medicare world. I would say the only choice that's really definitive on determining your options in the future is when you first start deciding if you want to go with a Medicare supplement policy or the Medicare Advantage world.
All right. Yeah, that does seem like a big decision. Is this our last question?
It is. It's from Tina in Racine. She writes, I had to cancel my Common Ground insurance due to losing my job. I'm now on state insurance. I paid $117 per month when I had my old insurance. It took 2 months for them to cancel my insurance, and now they sent me paperwork which states this is not a bill, but it's showing I have a balance of over $8,000. I've never had this happen before. I know nothing about health insurance, and I'm scared that they are not being truthful. So her question, how do I find out what my insurance bill is for?
That does sound stressful for Tina, not knowing where this bill is coming from. Is this a question you get from time to time?
I would say, yeah, we get lots of questions about, hey, I got this bill in the mail from my provider and I don't know what it's for. I thought my insurance would cover this service. I would say the first thing to do when you receive a bill and you're not sure what's going on with it, you're not sure what the charge is for, is to reach out to your provider and confirm that the bill is accurate. So, I went to receive care. I'm going to call that doctor, the medical professional, be like, hey, I got this bill. Is this accurate?
So the hospital system.
Yes, the hospital system, the healthcare provider, whomever that might be. And then once you've received that, it's important to locate your Medicare explanation of benefits, which is a document you'll receive that explains, hey, this is the service you got. These are the benefits you should have. And that's going to be something that happens whether you have an Advantage plan or original Medicare. And then once you've received those two documents, you've kind of compared. And, if you still have additional confusion, I think that's the point where you'd want to either dispute the bill, so challenge what's on that bill, or reach out to somebody like our program who can help you understand what benefits are included in your plan. I know we recently had a caller who had some dental benefits in his Medicare Advantage plan and went to a dental provider and received a bill and thought, hey, I went to see my dental provider and I thought this service would be covered. And it turns out that Medicare Advantage plan had a very specific exclusion for emergency care. So the dental procedure he received was an emergency service, so it wasn't covered under his dental insurance within his plan. So some of those really nuanced specifics that can come up with Medicare insurance, like any other product, is something that we can definitely help with and help you navigate that situation. But I would start by checking with the provider because, so often we can see billing issues that just occur on a provider level. Maybe the bill was submitted to the wrong place. Maybe you have two insurances on file and they submitted it to the wrong one. That's something that can be very quickly addressed by just talking to the provider.
And if someone disputes a bill, that pauses it, correct? While that's in dispute, so they don't have to worry about the letter they got that says this needs to be paid by a certain date. It would pause it for them?
Yes, typically that is gonna pause the requirement to pay the bill. I'd also caution against, panic paying the bill. The first thing I would do is make sure that bill is legitimate, talk to that provider, because we do see lots of, fraud in the Medicare space. There's definitely lots of scams out there, people trying to take advantage of vulnerable populations. And that's where our program will make lots of referrals to the Senior Medicare Patrol. And they do a really wonderful job of investigating those potential fraud cases. So.
Well, Nick, thank you so much for taking the time to answer our questions today. Is there anything else you would want to just warn consumers about in general with this upcoming open enrollment?
I don't think I have any warnings necessarily. I would just encourage everyone to check out Medicare.gov, look at all their plan options, make sure before they make that enrollment, they've looked at all of the options that are out there, and don't necessarily stick with the same plan because that's the plan you had the year before, because those Advantage plans, those drug plans, they change every year. So make sure you're reviewing your coverage and taking a look at all those options that are out there.
Okay, a lot of good advice today. I hope it was helpful to everyone who submitted a question. If you would like to submit a question for a future Ask Contact 6 segment or suggest a topic, you can go to fox6now.com and click on the blue Ask Contact 6 button. Thanks again to everyone who submitted a question. Thanks also to my colleagues who make this segment possible, including executive producer Sarah Smith, editor Dave Machuda, chief photographer Kale Zimney, Tim Primo on the video switcher, and Craig Sween in graphics. I'm Jenna Sack. Max. Thanks for joining us.